Good morning. My name is Mike Lehman, and most of you know I am the CEO of the company. You know, we started years ago, over 20 years ago, as a hospital, very small surgical hospital, with about 50 employees. And now we're at 350 employees, and we see thousands of patients every year. Our current electronic health record system, as you all know, is a little outdated, and it's time to give some thought to a new EHR. As we've grown, we've noticed a lot of things that have hindered us from providing the best patient care possible, which we know is the number one priority I have here, is serving our patients to the best of our abilities. To really move forward with the new EHR process and get everybody to get to know what our plan is and get their input, it's important to know what all the components of a good EHR are. With that said, there's administrative processes, communication and connectivity, decision support, dentistry and optometry, health information data, order entry management, patient support results management, and population health management. All of these components affect each and every one of you, and I'll briefly run through these, as well as talk about how a new EHR will affect positive health care to our patients. First of the components that I talked to you about was administrative processes. This applies to the registration process. I've heard a lot of frustration from a lot of people that do registration, how archaic our current system is. We have several components all connected to one that don't necessarily communicate with the other. So we have family practice, inputting information about a patient that come to get an x-ray in radiology, and they have to totally input all this information into that. So the administrative process in an EHR, this component, will dramatically help the registration process. It helps us with the financial, it helps us with finances at the end of the road so that we can better collect payment, so that we can effectively run and stay open and get our reimbursements. The next component is communication and connectivity. This provides a means for electronic communication between healthcare providers and patients. So email, mobile devices, text messaging, these things that we all use on a day-to-day basis to communicate, we can integrate into our patient care. Well, I'll talk more heavily about that in a little bit. This part really excites me for patient care. Decision support is another component. And this allows integrated databases to be input at the point of care so that our providers can make a better decision about the treatment for our patients. Instead of opening up textbooks and taking the time that could be better used on one-on-one patient care, it will give them instant access to a lot of information that will help them determine the best course of care for our patients. The dentist optometry portion or component of a EHR, we won't really touch on here at the hospital because right now we don't use this, and the resources that it would take at this point to get all of our community dentists and optometrists on board with this would take a lot of time. But it's a component that could be really important for the future. As we all know, studies have shown that good dental care and good eyesight and good eye care really ties into the whole patient health scenario. Health information and data is another component of the EHR. It applies to patient demographics. It gives the hospital the ability to enter and access information needed to make clinical decisions. Diagnoses, medications, allergies, and results reported will all be at the fingertips of everybody in our facility. Right now, we have a couple of components of our current outdated EHR that do not communicate with each other. So when a patient sees someone at the family practice clinic and they go to get a surgical consult, they're not seeing the allergies that the patient might have that might be critical in outlining the patient's proper care. Another component is order entry management. This allows the entry of laboratory, pharmacy, radiology, and other orders via the computer system. How huge would it be for our facility when one of our patients is seen at the family practice or at the urgent care and the doctors can sit and order what radiology exams are needed and it be automatically processed to that radiology department, whereas currently it's all paper. Another component is patient support and results management. This component applies to laboratory it allows us to manage historical information. And from a reimbursement standpoint, this gives us the ability to get all of our claims first time. Another component is population health management. Population health management provides data collections tools to support any public requirements that are put on us. And as you know, as healthcare changes day to day, month to month, year to year, there's a lot of requirements that are asked of us from outside entities that right now people are digging through paperwork, trying to find all the answers. This will give us that fingertip access to all that data. So for example, the meaningful use that a lot of you know about. What really excites me about this is the ability for us to communicate with our patients via technology. And there are several things, the cell phone, using kiosks for patients to check in, the portal technology that we have now that doesn't communicate, doesn't put radiology reports on the portal for the patients. But if we integrate a new EHR, the patients will be able to come into our facility, check in at a kiosk for those that like to use it, which would, in turn, free up those registration clerks to do other things. As we've grown and grown and grown, we've asked so much of you, staff, to do more with less. And that's what this EHR will allow us to do. Will allow us to better care for our patients with communication through cell phones, through computer systems. It will allow them to request things from their physicians through real-time data, through a cell phone or through a computer without having to come in and do an office visit. It will allow them to be more proactively involved in their health care. This in turn will make for better patient satisfaction, will allow us to concentrate more on patient care. So with that said, what we're going to do is we are looking into purchasing a new EHR. And over the course of the next couple months, I want feedback from all of you. I don't want to make this decision without having everybody's input. This is going to be our tool, our hospital's tool, to better care for our patients and to move us forward to be better online with the current practices in the medical field. Thank you all, and have a great day.